Good morning. My name is Crystal Budd, and I'm from Health Plans for Less. And I'm here to share with you a little bit this morning about Medicare. I do offer health insurance to individuals and to companies, and I can offer you life insurance, but today I want to talk to you about Medicare. Medicare is offered to individuals that turn 65, and when they turn 65, they're presented, let me grab my little book here, this Medicare and You booklet. And for those of you that are good readers, you might tend to try to read it, but I would challenge you to get through maybe the first 10 pages and you'll probably set it down and say, okay, how can I get through this without so much effort and confusion? So one of the nice things that I can offer to you and your friends, family, or clients is that I can take all the paper that they're going to send you, and this is just the first of many, okay? You're going to get papers from all the different carriers that are offered in the state because that's how they can market to you. So you can imagine if that's their point of contact, you're going to get a lot of paper. So, and then it creates a lot of confusion because the individual feels the pressure that I got to read all this stuff so I know what I'm doing, right? I got to educate myself. So the way to educate yourself really is to find a professional. Because the professional, somebody who's educated and understands the market, that works in it every day, can basically, you've heard that term, they'll cut to the chase. And that means we'll get to the point quickly. And that's my job. So what I ask the individual when I meet with them, or whether it's in face-to-face, on the phone, sometimes fax, email, I do whatever's comfortable for them. And in today's environment, that's great that we have all those options. We do not have to meet face-to-face. So I ask them simple questions like, do you want to keep the doctor that you have? Most people say absolutely. When we're transitioning from traditional health care to Medicare, the nervous reaction I get is, am I going to get to keep my doctors? That's big because some people have had a long history of health issues and they're fearful of losing the care that they've been receiving. The quality of care, the type of care. So it's really important. My goal is to make that transition when it happens be seamless. And what that means is that you shouldn't feel anything different. And hopefully we'll improve the situation. That's my goal. Can I make it better for you? So I ask them, give me the names of the doctors that you really want to keep. Tell me about the medications you're taking. I need to know the frequency and the quantities. I have a software system that allows me to put that in, that gives me a lot of information so that I can look at what's best for the individual. I can also say to them, do you want an HMO or a PPO? What are you used to having? Do you have doctors basically in the area you live? I have some clients, they have doctors all over, specialists that they want to go to. Some might be in LA and San Diego and Riverside, and they're not a good client for an HMO, right? HMO, I get this question a lot too, is what's the difference? If they've only had a PPO, they don't even know what an HMO is. So I explain to them what the differences are between an HMO and a PPO. And then they're like, oh, and then they'll tell me, well, is one more expensive than the other? In individual market, normally, yes, an HMO is a little less expensive than a PPO. However, you never know in this arena. I've had Cobra that can be, you would think it would be more expensive, that could be less expensive. So you just have to look at all the variables. I always say just get a professional involved, let them put it together for you so you can make an educated decision. So that's my job, is to help you make an educated decision. Once I gather the information for Medicare, and we look at, do you want an HMO or PPO, I can present both options to the individual. And then they're able to say, well, we're very fortunate in Orange County. We have a lot of really good doctors and a lot of really good hospitals. So many people choose the HMO model because those plans have a $0 premium. The PPO models cost about $160 a month on average when you're first coming into Medicare. And I say that with a disclaimer because things change. So they're affordable for what you're getting. You can get one of the best plans on the market that they offer in Medicare, and it's very affordable. So when people say, oh, I'm turning 65, I'm going into Medicare, if they're paying $1,500 a month for their health insurance, and now they can get a really good plan for a couple $100 plus Medicare, paying Medicare Part B, you're looking at maybe $350 a month. That's pretty good. You get really good insurance, right? Now, these are with a disclaimer because you have to look at counties with zip codes and ages and what their drug needs are, and plans differ. So, but affordability-wise, Medicare is a tremendous blessing to the people that are here in this country. It's a great program. And when I hear people complain about it, I think we're very fortunate. We have a great program for seniors. Most people also are concerned about if I move, or let's say I'm traveling out of the country, how is that going to affect me? Well, if you move, if you buy a PPO plan, you can take it with you. You don't have to change unless you go to the other state and they have a better program. Now, personally, I'm contracted and certified in California. I had somebody that just called me yesterday and said, can you help me? I'm in New York. And I'm like, I'm not certified or contracted in New York, so you have to talk to somebody who is in that particular state. So for me personally, I am contracted in California, so I can help anybody in anywhere California. And I have clients in Northern California and San Diego and San Bernardino, and I can do business, like I said, over the phone, fax, and email. So I can offer my services to people that that aren't here locally in Orange County. Another question that comes up often about their drugs, because drugs can be very costly, and there's this part about the donut hole that they don't understand. I hear this thing about a donut hole. What does that mean? It's very confusing. So essentially, what does that mean? The donut hole, because drugs are a big part of why you choose a plan, because those are things that you're going to be getting consistently every month. And they are some of these drugs. I have clients that have $1,000 a month drug they're taking, and they're like concerned about how am I going to pay for that. So what we do is, we put it in the system and we look at the variables. And when drugs are purchased from a pharmacy, they have what they call the retail rate, the contracted rate with that company. Then it may be discounted. They work their contract rate with that particular company that they like. Let's say Blue Shield connects with Save-On, or I was thinking of Rite Aid or CVS. Any of these drug carriers, they have preferred pharmacies. So if you go to their preferred pharmacy, they may discount the drug rate, but you're going to pay a copay. So let's say the drug if it was $500 a month, and it falls in a tier 3, which is a non-preferred drug, and it has a $95 copay, you're going to pay $95, even though it's $500, right? But they'll take that $500 each month, and if you have a $4,500 cap before you go in the donut hole, they're going to take $500 and deduct it from that $4,500 until you get to zero. Does that make sense? But you're still paying $95. But once you get to that cap, you go into the donut hole. And at that donut hole, then you start to pay a percentage of the drug cost. It might be 25%. So out of a $500 drug, you're going to pay, what, $125 for just a few months until you reach what they call the catastrophic cap. And then that's why it's confusing. And once you get to the catastrophic cap, then it goes to maybe a 3 or 5% cost. It goes way down. So what I tell people when you're looking at the drug costs is we break it up as an annual, and we're saying, okay, these months you're paying $95, but here you might pay $120. So I say set aside what the total cost for the year each month. So when you get there, you have the money to pay. All of a sudden you're not hit with a $120 bill. So it needs to be explained, and that's why I say to get a professional involved, it doesn't cost you anything. Whether it's me or another professional, there's no cost for our services. So it does you a huge benefit to get someone involved so you don't have to read all the papers, and we can narrow it down to what your specific needs are. And the HMOs, like I said, there's so many good hospitals and doctors, it's easy to find a fit for many people. Some people absolutely want to they don't mind paying the premium for the policy, and they want to have freedom to choose, meaning they can self-refer to, if they take Medicare, you can go anywhere you want. That's the PPO. But you do have to pay more for that freedom and that choice. But the HMOs, just to explain that a little further, you have to choose a primary care physician within a medical group, and then you seek the referral from your primary care physician to go to the specialist, and you must go to the hospitals that are within that network. But like I said, oftentimes I can get everything they want, and it still works in an HMO. As long as they trust their doctor and they have a good relationship with their doctor, they can make it work. So again, it's up to you. That's what's nice, is we do have the freedom to choose here. You can choose a PPO or an HMO, depending upon what your budget will bear. There's another nice feature I tell clients. If you're nervous about trying an HMO, they give you 1 year guaranteed. You can switch back to a PPO with no questions asked if you want to try it and you're nervous about it. So you can do that with Medicare. They give you that option. So I think that's really a nice thing if somebody says, well, I would really like to save the money, but I've never tried an HMO and I'm not sure about it. Well, I said, you can try it, and then they'll take you, even if you had a serious health problem, they would still allow you to go into the PPO. So, and I've had that happen a couple times where people have gotten really sick and they're like, I want to see this brain surgeon in, San Francisco, but if on the HMO I can't do that, but the PPO I can. So, those are things to think about. How do you value your health care? What's important to you? Are your drugs covered? Can I see my physicians? And if I do my job and I do it well, then hopefully I can achieve everything that you want, and you won't even feel the transition. It'll be a little lighter on your pocketbook. That's what you're going to be blessed with. Maybe you go out to dinner a few more times instead of cook or something. Maybe take a vacation because you're not spending $1,500 on your health insurance. Now you can go out of town and do something fun. But Medicare is a great program, and I feel like we're really blessed to be here in this country to have these programs. Yes.
Do people go on Medicare and also have like secondary insurance, or do people pretty much Medicare only?
Okay, well, that's a really good question. So Medicare...
Part two to that question.
Okay, well, and I need to clarify that because Medicare doesn't cover everything. Medicare is Parts A. When you are a U.S. citizen and you've worked and paid in 10 consecutive years, then you're eligible for Part A for free, and that's hospitalization. But it has a deductible, and that deductible has to be met before they'll pay anything for hospitalization. It's over $1,600, and it can be more than once. It's not like a traditional health plan. It can be multiple times if you go in for multiple reasons. So most people don't want to have just straight Medicare, and Part B with Medicare says that you're responsible for 20% of all the bills for outpatient services. So there's no cap. So if I have an expensive bill and I have to pay 20% of that bill, and it's $200,000, okay, that's a lot of money. There's no cap on that. So most people don't have just Medicare. And you must have Parts A and B, and there's a premium to Part B that enables you then to buy the supplement or the Medicare Advantage plan.
Okay.
And most people add that because they have, like the Medicare supplements covers just about everything except they have a small deductible. That's your PPO style plan. And then you have the HMO model that has max out-of-pockets. Now, some of you are glazing over. I can see that right now. You're like, well, I don't know what she's talking about. But that's the reason why you need somebody who understands it.
So
Part two is?
Does the employer have any responsibility for that additional insurance?
No, they do not. Especially with small companies, they're not responsible. And most of the time, larger companies, they do offer plans they can stay on the group plans. And I just had somebody call me the other day that said, I want to retire. I'm faced with what is it going to cost me because if I retire, I can go on Medicare, but then I have a spouse on my plan. They're going to have to go off the plan because they can't stay on the plan and get their own plan. So, there's sometimes a little bit complications in trying to figure out what's it going to cost me. Or if I want to retire and maybe I'm 63, what is that going to look like? So we can do a little bit of forecasting and tell them this is what it looks like today. Now, again, Things can change, but I can give them a kind of an idea of what they're up against if they're looking at retirement. And so I'm not sure I answered your question. Did I answer your question?
In case in point, Glenn will be, I think, turning 65 next year.
Yeah.
So he'll be on Medicare.
So he'll transition off of your plan.
Being an employer,
Yeah.
do I have to pay for his second?
No. So he will sign up for Medicare.
He's on his own. Come on.
Yeah. Well, it'll be a benefit to him and a benefit to your company because he'll go on to Medicare and he'll pay his premium to Medicare. And then, he can get better insurance for, let's say that it's $350 a month on the high side for a PPO or less if he does the HMO. And then you're not paying that premium. He gets to take a waiver if he's still working. Doesn't count against your small group, so your small group will exist, can stay in place.
Yeah.
He comes off and now has Medicare. And he'll have better insurance and lower cost.
Okay, that was
You're not
right now,
required.
it's in our group policies.
Yeah, but you're not
We're obligated
required.
to pay a portion of that.
No, you're not.
Now,
You're not.
If he turns 65, he's off.
He's
the whole
on his
plan.
own.
He's on his own.
Unless you choose to do something for him. So, Guy, if you decide that you want to do something for him, that's between your company and him. Because some people will do that. Some people will offer something. Any other questions? Any other questions, Mike?
So what about what the scenario you painted? What about Lynn's spouse? How is she affected by coming off?
She is affected. She would then have to find an individual plan. So that's, again, where having somebody, like I've had people that if they're on really expensive medications, one of the spouses, and I look at the numbers and I tell them you're way better off staying on the group plan and paying that, going on to COBRA, in other words. If they're coming off, if they're no longer working, then they can stay on the group plan, even though they're 65, because there's no donut hole. And in some cases, it makes sense for them to stay on the group plan. In some cases, it doesn't make sense. So there's no hard and fast rule. It's basically you got to look at each individual separately because everybody's needs are different. It's like doing a little dance. You just got to work the numbers, and it really comes down to the numbers in the end. What your needs are, but what do the numbers look like? Yes.
I have no idea what she does because I just want her to do it. But I had my hip replaced in 15 and the other hip replaced in 20.
Yeah.
And, it cost me $9.
Yeah.
Whatever mumbo jumbo was.
And that's the truth. That's what people say. Whatever mumbo jumbo.
But you didn't pay.
Yeah.
Or at least you don't remember. I don't remember.
All right. Were there any other questions?
Great job.
There are so many variables, and that's the thing is, it's a scary proposition. Every senior I've ever talked to, they're hesitant and they're concerned because it's something new, and something new is always scary because we don't know the outcome until we get into it. And so, but I can tell you one thing: I do my best to really look at things thoroughly and make sure that you are satisfied. And I do my best to answer your questions. And I'll have a client just text me, and I always say text is a great way to communicate. If they just have a simple question, because I can get to them right away. It's like, I need to see a so-and-so, and I forgot what I'm supposed to do, or, I'm having a problem with this drug, what should I do? So it's simple. That's a great way to communicate. I prefer actually texting over email because I can get back to you quicker. So, did you have a question too?
Well, I just wanted to say that my mom's donut hole, because she takes insulin, was once $800 a month.
Yeah.
And Crystal worked out a plan for us that I think all her prescriptions would only be $700 a year.
Mm-hmm.
So it pays to, you don't know it's coming until they hit you.
Yeah.
And you need it.
Well, and all plans are different. One plan, their formularies or what they cover for drugs are not all the same. And if you take one particular insulin that works, that's the only one that works for you, and that company doesn't offer that, they offer other alternatives, then we need to look at a company that does cover that one, because they differ. Their companies are only required to offer in categories a drug. It may not be the drug you want. And then if they don't have the drug you want, you have to ask for an exception, but it does not have to be granted. That is an exception. So when we're starting out, I want to make sure that the drugs that you take are covered so that we don't have a problem. And then if they make changes, they have to notify you. And then they will make an exception typically through the end of the year, but then you're forced to try to find it elsewhere if you can. Anyway, I think I went over my time, but anyway. Thank you very much.